So my name is Deignan. I'm a pediatric orthopedic surgeon. I am a part of Baycare Medical Group, and I practice at St. Joseph's Children's Hospital. Conditions that I personally find interesting to treat are conditions in the newborn, and that be specifically hip dysplasia and clubfoot. Those are conditions that are easily treated in the newborn setting, so a child that even at a few weeks of life can be treated for these conditions. And the great thing about a child being that young is their body is so adaptive, it's so plastic. In other words, we can get away with treating them conservatively and having a great outcome. For example, a child born with a clubfoot, even as recently as 20 years ago, was treated surgically at a young age, and the results ended up being somewhat disappointing. We found that the feet were often stiff, often required additional surgery when they reached closer to adulthood. And so there's a technique known as the Ponseti Technique, introduced by Dr. Ponseti of Iowa, who advocated casting the feet through serial casting to correct the position of the foot in the first few weeks of life. And this is something that I've specifically trained in and feel is an area that I excel in performing the Ponseti technique correctly. So another condition I treat is hip dysplasia, which is a condition that when children are born entails underdevelopment of the hip. And this is again something that can be treated conservatively with what we call a Pavlik harness, which is a canvas harness that kids wear typically for 2 to 3 months, which keeps the hip in the socket and permits normal growth and development and stabilizes the hip as they grow. This is a condition that then we follow with typically with a serial ultrasound or an ultrasound every 3 to 4 weeks to make sure that the hip is improving. And that's something that I personally take pride in, is that I've sought out the extra training to specialize specifically in pediatric orthopedics. It's the only thing I treat. I do not offer adult orthopedic treatment, so I focus specifically on children alone, and I think that focus at St. Joseph's Children's in multiple aspects seems to provide children with the best care.